Hi everyone, thanks so much for tuning in. This is video number 10. Wow, what an action-packed 24 hours it's been. Yesterday, you had the opportunity to learn from two physicians here in town what their opinions are on this current pandemic, as well as their opinions on social distancing. I wanted to take the opportunity to interview my dad, an infectious disease specialist, and allow you to learn from a different perspective. So, Dad, while you may not need an introduction to many people who are watching, and your resume is quite extensive, can you tell us a little bit about your level of experience within the realm of infectious diseases?
Well, I did my medical school in Grant Medical College in Bombay way back in late 50s, and after I graduated I had considerable interest in infectious disease. As a result, I decided to stay back for 3.5 years in a 1800 bedded JJ hospital, which was very well known community hospital catered for number of infectious diseases, including having been involved in a mini epidemic of smallpox as well as cholera. After my graduation, I decided to go to England to have further qualification in tropical disease, and had also had the occasion to work in university hospital affiliated with Hospital for Tropical Diseases in London, and did a tropical study and training at Liverpool School of Medicine. Got boarded in all those, and subsequently went and practiced in East Africa, initially in Uganda and subsequently in Tanzania, where I was also involved in extensive handling of patients with very severe malaria, tuberculosis, leprosy, and even certain viruses like yellow fever and Marburg virus while we were in Uganda. Subsequently, because of the political upheaval, I decided to move on to Canada and ultimately to Pittsburgh, where I was affiliated for 4.5 years with infectious disease team. And we had a lot of research work going on, and subsequently finally moved to Bakersfield and have been in Bakersfield for the last 41 years. 36 years of that I had spent at Gunn Medical Center, particularly in the teaching side of internal medicine as well as family practice resident, simultaneously continuing my practice in infectious disease. I am boarded in infectious disease, in tropical medicine, as well as in internal medicine.
Wow, that is a lot. I don't think I even knew all of that. The reason I wanted to teach you about that is to give you an idea of Dr. Amin's experience with infectious disease, not only here in our community, but throughout the world. So now, Dad, I'd like to open the floor up to you before we ask specific questions and address a little bit about what we heard yesterday. Can you tell us about the present pandemic and the virus itself?
Well, let me begin with two basic things. One is the virus itself. COVID-19 is a type of coronavirus. Coronavirus is a class of viruses which includes our common cold virus, our influenza A and influenza B virus as well. Now, COVID is a very unknown emerging virus. This virus apparently has mutated from the basic coronavirus. Now, whether it has originated from animals, whether it has originated from the wet market is very much unclear. However, this virus is a deadly killer. Unlike your flu virus or other coronavirus, this virus spreads very rapidly like a wildfire. It has been a pandemic now. The last pandemic we had was in 1918, again of a coronavirus. But this pandemic initially started from Wuhan province in China and ultimately moved on to whole of Europe, then to Middle East, and subsequently came down to North America, including Canada and United States. It has also started flourishing now in the subcontinent of India, as well as many countries in continent of Africa. This virus is unlike any virus we have known. We don't have much knowledge about this virus as to how it behaves, what can we do to treat it, or probably produce a vaccine down the road. This virus, as you know, has already caused almost about 2.7 million people infected, including 184,000 deaths. That includes quite a number of deaths in the United States itself, causing 840,000 infections and almost about 47,000 deaths. So I can say that this virus is not a virus to be taken very lightly. It is a killer virus. It is a virus which spreads very rapidly, and it doesn't spare anybody, whether you are young, whether you are old, or whether you are adult.
Dad, I just wanted to ask you for one clarification. You mentioned coronavirus and influenza. Are they from the same family?
Well, influenza is a coronavirus, type of a coronavirus. Ultimately, we know its genetic formation, and that's why we have coined it as influenza virus A or influenza virus B.
So we've separated them because we understand enough about the basic coronavirus and influenza.
Correct.
But they do have some virological similarities.
Yes.
And you mentioned the last pandemic was in 1918. Now, that's the Spanish flu. What about MERS and SARS? Were those with this virus?
Well, that also belongs to the group of coronavirus. Mm-hmm. SARS apparently, as you know, appeared in Southeast Asia. MERS apparently happened in Middle East. And then, of course, Ebola. Ebola is a different virus altogether, and that occurred in essentially in Africa.
Okay. All right. So let's talk about a few points that were made yesterday that I would like your take on. We heard in the video yesterday that perhaps we have gone too far and that we've never really quarantined healthy people before. Quarantine is defined as a period of strict isolation to determine whether someone has contracted an infectious disease. And while we are using the terms quarantine and social distancing interchangeably, we're not actually quarantining healthy people. We are asking healthy individuals to socially distance from one another. So why is this social distancing even important for healthy people?
Well, you have very rightly said that quarantine and social distancing can be interchangeably said. Quarantine in the past, we used to use that particular term when a patient is highly infectious like measles, and we isolate them completely. At present, with COVID-19, we have to say up front that we don't know enough about it, and it can spread from a person to person. Even an asymptomatic person, 25% of them, can spread this virus without knowing it. As a result of that, this social isolation has become a very big help, as it is very evident from what data we have got from New York State. That social isolation has definitely plateaued out now. The number of hospitalization, number of people put on the ventilator has gone down. The death rate has definitely started going down, though it is still pretty high. So isolation, social isolation is the ideal way at present for this COVID-19.
Right. And I think it's important that you bring up the exact same number that we heard yesterday. 25% of individuals may in fact be infected with COVID-19, but be completely asymptomatic.
That is correct. That they will be entirely asymptomatic, they may not even know that they are harboring the virus, and yet they can spread the virus.
And so that's why we need everyone to practice social distancing, not just those with symptoms, but those who do not have symptoms, because up to 25% of those individuals could be spreading the virus throughout the community, but not even knowing that they are doing so.
That is correct.
Okay. I'm also hearing that social distancing has been impactful. It has reduced hospitalizations. It has reduced the number of deaths since it has been implemented. Do you agree with that?
Yes, it has definitely, as you can see from most of the data, not only from New York State, but also from the European countries, that when they decided to isolate people, completely shut down the businesses, transit system, the number of cases went down considerably, the death rate also went down considerably.
Okay. Yesterday, we heard a little bit about the potential of doing harm to the immune system during social distancing. Do you feel that isolating ourselves for a short period of time actually causes our immune system to be less strong?
Let me tell you a little bit basic about the immune system itself. Immune system is a protective or a barrier system in our body. It is inbred system that has two components. One is the white cell count, which are our soldiers, that whenever our body is attacked by either bacteria, viruses, parasite, or fungi, it will attack them. Second barrier system we have got is called immunoglobulins, and this immunoglobulin and the white cell count are there all the time in our system.
Immunoglobulins are antibodies, correct?
Yes. Ultimately, immunoglobulins will produce antibodies when they will attack the offending pathogen. Now, whenever this immune system is reduced to a certain extent, and say people like cancer, people who have got certain infectious diseases like HIV, which used to completely hamper the immune system, people who have to undergo certain toxic medication administration like chemotherapy or long-term steroid, that their immune system will be damaged to a certain extent. And if people have a long-standing chronic diseases like chronic lung disease, like very severe heart problems with congestive heart failure, their immune system will be relatively low. Again, same thing happens to elderly people. Their effectiveness of their immune system is a little bit lower than a healthy young person. However, social isolation has no bearing or has no effect on the immune system at all.
Okay. Do you lose our normal flora, the normal viruses and fungi and bacteria that live on our skin, simply by social distancing from other human beings?
No. They are going to be there all the time. They are your friendly neighbors most of the time.
Right.
And I think our immune system protects us if they are going to invade our system.
And do you lose immunity to other viruses or bacteria? So for example, I had chickenpox as a child. If I socially distance myself for a period of 2 weeks, 3 months, 6 months, do I lose immunity to any viruses I've been exposed to in the past?
You are not likely to. This immunity to certain viruses is a permanent thing, and you are not likely to lose it.
Okay. Now, let's talk a little bit about testing. Yesterday, we heard quite a bit in terms of statistical analysis, and much of it was based on testing, specifically positive testing. And I would like to ask you, how accurate do you feel that this testing that we have available is right now? How much information can we learn or extrapolate from the testing if we haven't tested healthy individuals and we don't even know if our testing is in fact truly accurate?
Well, this testing business has become very confusing. Previously, all we had was the PCR when we did the nasal swab. They were pretty more accurate. Subsequently, we have a lot of commercial testing that has been done. Unfortunately, these commercial testing are not very accurate. They have got both false positive and false negative, in the sense that people can have the disease and still the test may be negative. Or people may not have the disease and the test can be positive. So you can see from that that the testing is not completely accurate unless it has been approved by FDA. I will be a little bit skeptical about this commercial testing. However, again, healthy people, you test them, and if they are negative, that doesn't mean that they may not be carrying the virus, because it may be false negative and they may be spreading the virus.
Right. So there's still so much in the way of advancement that needs to be done on creating tests where the specificity and the sensitivity or the accuracy is better than what we currently have available.
Yes, that is very, very true. And once that kind of testing is available through FDA approval, it can help if you can do a very widespread massive screening.
Right. So random sampling is what's important, not basing numbers strictly on those who've been tested, where in our community it's really only those who are moderate to severely ill that are getting tested in the first place.
You are very right, because the thing is that we may be missing a lot of people who are entirely asymptomatic and spreading the virus.
Right. Okay. Yesterday, we heard repeatedly about millions of cases, small number of death. Millions of cases, small number of death. The CDC reports 47,000 COVID-19 deaths since March 20th, a little bit over a month ago. It has been roughly 1,500 to 3,000 deaths per day over the last 2 weeks, making COVID-19 the leading cause of death above car accidents, heart disease, and all cancers combined. Since this time, March 20th, 42 of the 50 states have had formal stay-at-home orders. And we heard that these orders don't need to be in place anymore. What do you think would happen to the death rate if we abruptly lifted these orders right now?
Well, first of all, let me tell you that trying to compare how many people are infected versus how many people are dead is not appropriate. It is the death that is more important. If your own family member gets it and dies, it is very painful, it is very agonizing, it is very heartbreaking. So even if there are 185,000 people died from this particular virus all over the globe, or probably having had almost about 47,000 died in the United States, it hurts. Doesn't matter how many people have tested positive. So don't try to compare the number of positive to number of deaths. It is the mortality which is more important, and it is that we have got to save.
Right. Do you think that by lifting the shelter-in-place orders now and too abruptly, we will have an increased number of deaths?
There is no doubt in my mind that if we abruptly remove all the restrictions we have been putting at present, which has helped us a lot in trying to prevent the spread of the virus, it will definitely flare up. And before we have a second wave, we are going to have another endemic here locally, which will be increasing in number of cases as well as deaths.
Okay. So it seems that lifting these orders would increase sickness, which in turn would increase urgent care visits, increase emergency room visits, increase hospitalizations, increase ventilator use, and exactly what we have been able to avoid thus far in California, which is overwhelming our healthcare system, could be in fact negated.
Yes, that is very, very true, that if we try to have CDC guidelines followed very religiously, we have seen the result in New York State and in other states which has followed that particular guidelines, that the numbers are staying a little bit on the lower side, not completely on down the flat curve, but definitely lower. Okay. Same thing about the death rate.
All right. Speaking of death, let's compare death between influenza and COVID-19. Yesterday, we learned that in the 2017-2018 flu season, which is usually a period of 6 months, there were 38,000 flu-related deaths in the U.S. And I just mentioned that in the last 30 days, 1/6 of that time, we've had 47,000 COVID-19 deaths. So 11,000 more deaths in a period of 1/6 of the time as influenza. And that is with a shelter in place. So again, we cannot compare influenza and COVID-19, correct?
You are very right that influenza A and B is a different kind of virus. We know a lot about it. We have definite even treatment now, and the treatment is definitely improved from 2 drugs to 4 drugs, including people who are sick, that we can give IV Primenavir. The mortality rate, if you see, usually is in very young children or in elderly people whose immune systems are relatively weaker.
For influenza.
As compared to that, if you look at COVID-19, it doesn't look at your age, it doesn't look at your race, it doesn't look from where you are coming or what is your status in the society. It will attack you, and if you have a very severe infection and inflammation of your lung, it can even kill you. So there is no comparison between the two kinds of viruses. The COVID-19, we don't know very much about it. We don't have any treatment at present. There are a lot of testing going on all over the country, all over in Europe as well. We have the first stage of vaccine also being tried, but we are almost about 10 to 12 months away from getting an effective vaccine. So it is fallacious to really compare influenza A and B, mortality, or the virus to COVID-19.
Okay. Something that a lot of people have discussed with me is this concept of herd immunity. They feel that we should not be under social quarantine. We should be out in the public. We should be getting exposed to this virus so that we can develop immunity to it. And one argument is that this virus is very virulent and maybe you won't have the opportunity to develop immunity to it because it's going to kill you. But tell me, doesn't herd immunity, is that concept based on the fact that if you get this virus that you cannot be reinfected?
Well, herd immunity is usually been known in certain kind of viruses. For example, polio, certain hepatitis A, certain other viral infection, where exposing to them, in fact, when I was a child, I was being told that most of our youngsters were being exposed to children who had chicken pox, because they knew that once a child gets a chicken pox, he is immune for the rest of his life. Right. And that is very true. So that is herd immunity. And if we know about the virus, then we can talk about the herd immunity. As far as COVID-19 is concerned, we don't know. We don't know whether it is going to have an everlasting or relatively a short lasting immunity in our system. We don't even know whether there will be any second wave of infection or reinfection in an individual after they have recovered from the virus itself. So it is time that will tell us. It will be after a lot of other studies that will come out that we'll know about the herd immunity or immunity which we can acquire from COVID-19, or probably it will be everlasting or not.
Right. So until we know that once we've had infection with COVID-19, there is no chance of getting infected again, then the concept of herd immunity is really somewhat negligible. And we don't know that. We have an intuition, but we cannot act based on intuitions. We need to act based on knowledge that will come with further study of this virus.
Yes, you are very, very right that unless we have got enough data and unless we know enough about this particular virus and how it is going to affect the immune system or immunity, we cannot say that we will get the herd immunity from this virus.
Right. But we may do much more harm sending everybody out into the community, back to business as usual, and then getting infected.
That's correct, that we will be spreading the virus very rapidly.
Okay. So tell me, many people out there are frustrated. They are out of work, they're scared, they're anxious about their future. Social dynamics with the home and mental health are certainly not to be ignored through this pandemic, as well as with social distancing. Many people out there are starting to begin to question whether the cure, social distancing and its implications, are actually worse than the problem, the virus itself. What are your thoughts on this?
Well, I understand the feeling of most of you having been under the lockdown. It is very frustrating to stay at home because this virus is not only affecting health-wise, but it has caused an economic chaos all over the world. It is not only in the United States, it is all over the world. And as a result, people are scared, people are frustrated, people are very angry that why we have to be isolated when the death rate is still high. Well, if we don't isolate
Death rate is still
ourselves,
lowish, lower, getting better.
yes, and if we are going to isolate and if the spread is definitely slowed down, we can do a lot of good as compared to getting frustrated and say, let's open up the whole thing altogether in a bulk. That is going to cause a disaster, in my opinion, that it will definitely increase the number of patients, the number of economic side is going to go downhill, and people are going to be having more mental, physical, and social problems.
So, what advice do you have to our community? So many people have reached out to me and they have said, I just want to know what to believe. I have so much information being thrown at me through social media, through television news, through newspaper articles, and now even the doctors are starting to tell us different things. How can we guide the people in our community so that they can find some peace and resolution in this process? Understand that what they are doing right now, while it is frustrating and while it has its problems, is really there to do good and to help one another.
My answer is very simple. Listen to the experts. People like Dr. Fauci, Dr. Briggs, Dr. Redland. These are the people who have devoted their entire life to learning about the different kind of viruses. They are involved in the epidemics, right from Ebola to HIV to MERS to SARS. They are the ones who have learned by experience, though they may not be clinicians. So I would very strongly suggest that you listen to them. You listen to what data and what guidance we get from CDC. Different doctors are going to have different opinions. And I don't say that they shouldn't have their opinion. Opinions differ, but at the same time, we have got to listen to the experts who have a lifetime experience in dealing with this kind of problems. So my short answer is that listen to experts, listen to CDC guidelines, and stop listening to gossips or people who have different kind of opinions. Listen to people who will give you a very truthful data.
Thank you for that. And guys, I just want to share with you that my purpose in making these videos, along with my father, is to educate our community. I understand your confusion. I do not have any ulterior motives. We have no financial investment in COVID-19. We have no political affiliations, and we simply want to do good for this community. We want to be able to educate you as best as we possibly can. So I hope that you have enjoyed this interview. Thank you so much for watching, and until next time.
Thank you and be safe.